Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be talking about risk for falls, nursing diagnosis, and nursing care plans. A fall is an event that occurs when a person at rest accidentally comes to the ground or a lower area. A patient's fall risk is highly associated with serious injuries, including death. According to the World Health Organization, WHO, falls are a high risk major public health problem and is considered as being the second leading cause of accidental deaths. The rates are recorded higher in the older population with the age of 60 years and above. The injuries related to falls may vary depending on the situations involved and along with the age, gender, and health of the individual who sustained the fall. The following are known fall risk factors that can affect the severity of injuries. Age is one of the key risk factors for falls. Older people are known to be at an increased risk for falls and fall related injuries. This may be due to a decline in their physical, sensory, and cognitive ability, meaning mental status. Aside from old age, children are also known to be at higher risk for sustaining falls and fall related injuries. This is caused by their evolving developmental stages, their innate curiosity to explore things, and their general behavior as children. Gender. A fall can occur in both genders. However, it is noted that men are more likely to die from a fall than women. Other known risk factors for patient falls include occupational hazards, altered mental status, alcohol and or substance abuse, socioeconomic factors such as overcrowded housing, underlying medical conditions affecting physical, neurologic, and cardiac well-being, poor mobility, cognition, vision, and an unsafe environment. Now we'll look at a couple of nursing care plans for risk of falls. The first one would be risk for falls related to a major bone loss secondary to osteoporosis. For the desired outcome, the patient will understand the importance of using assistive devices and extra measures for preventing falls. Intervention. Complete a fall risk assessment. Factors contributing to fall risks usually are functional ability and use of mobility devices. Rationale. The use of a standard tool will help identify the status of the patient's risk for falling and will help determine the factors contributing to the high risk for falls. Intervention. Assess for fractures. Rationale. Osteoporosis leads to a loss in bone mass, which predisposes patients to fractures. Intervention. Provide identification to alert everyone of the high risk for fall. Rationale. This will help healthcare staff, families, and friends acknowledge the need for caution when dealing with this patient. Intervention. Put the bed at the lowest level. Rationale. Low set beds reduce the possibility of falls and serious injury related to falls. Intervention. Explain the bed settings to the patient, including how the bed remote controls work. Rationale. Allowing patients to set their own bed minimizes the risk of them jumping off the bed while it is in a higher position. Intervention. Place items within the patient's reach. Rationale. Items far away from the patient's reach may contribute to falls and fall-related injuries. Intervention. Evaluate the patient's understanding of the use of mobility-assisted devices, such as a Zimmer frame and crutches. Rationale. Improper use of mobility devices may cause more harm than good. Intervention. Assess the proper size and height of the mobility device to the patient's physique. Rationale. Using the wrong size on mobility devices does not give full mobility support to patients and may even cause further problems such as falls and fall-related injuries. Intervention. Assess the need for pain medications. Rationale. Osteoporosis patients that had recent fractures may experience pain, and pain leads to unsteady gait and mobility. Intervention. Referral to physiotherapy or occupational therapy. Rationale. Patients with osteoporosis may need therapies to help them regain independence and lower their risk of falling. Now we'll do a second nursing diagnosis and care plan, and this one would be related to Parkinson's disease. So Risk for falls related to cognitive impairment secondary to the disease process of Parkinson's disease. Desired outcome: the patient will maintain the ability to perform activities of daily living without having a fall. Intervention: complete a fall risk assessment. Rationale: creating an accurate status of patient's fall risk will help determine the needed interventions to help prevent falls from happening. Intervention: assess cognitive ability. Rationale: Parkinson's can affect the neurocognitive status of the patient. This assessment of their cognitive ability will help identify gaps and lapses in memory and judgment, which will lead the care plan and identify patient needs. Interventions: assess the patient's environment. Rationale: trip hazards can increase the risk of the patient falling. Also, making the environment familiar will improve navigation for the patient. Intervention: assess the ability to complete activities of daily living and assist as needed. Rationale: Parkinson can also affect patients' ability to perform simple tasks. Identifying the lapses in personal care will help identify the patient's changing care needs. Intervention: ensure the availability of mobility assistive devices. Rationale: mobility aids should be kept within the patient's reach to avoid accidental falls. Interventions: ensure the safety of the patient's environment through the following: declutter the space, avoid wet floors, provide adequate lighting, provide proper shoes and slippers, bed at the lowest level always, valuables should be within reach. Rationale: the safety of the environment plays a vital role in providing safety and avoiding trips and falls. So this concludes our little study guide on risk for falls, nursing diagnosis, and nursing care plans. I have about 3 or 4 more care plans on this at nursestudy.net. Just go to the search bar because I have over 800 care plans in there, and just search falls or risk for falls, and then that article will come up. We do have over, I think we're coming close to 800 nursing care plans now that are completely free for nursing students. So please visit us at nursestudy.net. This is Nurse Anna, and have a great week.